So without further ado, I'm really excited to bring up our first guest, who is President and CEO of the Alzheimer's Association, Joanne Pike. Well, thanks so much for being with us, Joanne.
Thank you.
So let's start with the science. We now have, a couple drugs now on the market for Alzheimer's. Kind of lay out the landscape in terms of the treatment options. What's the progress that's been made in the past few years, but also, what do we still have missing that we need?
Yeah, thank you, Peter. This is such an incredible moment within Alzheimer's treatment and research and the progress that we've been making. The pace of that progress has really been increasing over the last few years. But in thinking about what we still need, we also know that the pace of progress is going to pick up given everything that is in the pipeline and the knowledge that is being generated right now. Over the last few years, we now have 2 FDA-approved treatments that treat the underlying biology of the disease, targeting amyloid beta through the monoclonal antibodies. Those have been those first-line treatments that are available. But it's also important to recognize it's not just treatments, but it's the progress in diagnostics as well, where we're seeing progress in the ability to diagnose through blood, which really democratizes the access to an accurate and timely diagnosis for individuals who may have questions about their cognition. It also gives them the ability to access those treatments sooner. But we also know with some of the research trials that are going to be reporting out soon that there is this progress is not only about the monoclonal antibodies for amyloid beta, but we're also looking at other targets, the potential for combination therapy. And so this pace is only going to increase over the next 18 months.
Yeah, that's really exciting. So let's go there. I mean, what in terms of things in the pipeline or treatments or other things that are being worked on, what's kind of most exciting to you at the moment, or where should the focus be in terms of research efforts?
There's a couple of things that are in the near term that we know that are reporting out that I think is a lot of excitement building in the next couple of weeks at the Clinical Trials for Alzheimer's Disease conference in the first week of December. The EVOKE and EVOKE Plus trials that are looking at semaglutide, a GLP-1 to treat mild cognitive impairment due to Alzheimer's disease and early stage Alzheimer's disease. That's going to be reporting out. Again, giving us an opportunity to think about another target and what that means for treating those with Alzheimer's. We also know that the potential for a GLP-1 offers a different safety profile. It offers a different clinician path because it is already used today. So it also raises questions for us about how we can ensure the use of that potentially down the road. And another target gives us the ability to think about combination therapy. So there's lots of opportunity with a report out of that trial. And then in the moderate term, we don't know exactly what the timing is. We do know that Trailblazer 3 is reporting out on the use of donanemab in preclinical asymptomatic Alzheimer's disease. So those who have biomarkers but yet are not showing any clinical symptoms. And then behind that will be the AHEAD 3-45 trial that is looking at Leqembi and the use of Leqembi in that same type of asymptomatic population. So right there we have prevention trials happening to arrest or slow the progression into clinical decline for those who do not have symptoms. We have combination therapy. And then some new news that is coming out that is building on reports that the Alzheimer's Association made this summer is around our own lifestyle intervention study, US Pointer, where we were able to show that a structured, highly accountable intervention at the community level for nutrition, physical activity, social and cognitive training, and medical management of heart conditions can have an impact and slow decline of cognitive concerns over the course of that intervention trial, while we reported out the top line, the first results of that, at CTAD in the coming weeks, we'll be reporting out on some of the ancillary studies related to that as well, some of the imaging that is associated with that lifestyle intervention, sleep studies associated with that as well. So we're really excited to think about all of those key areas that I just mentioned, but also how does lifestyle impact cognition, Alzheimer's disease, and other dementias.
Yeah, that's really interesting, particularly on the GLP-1. I mean, I feel like a lot of people wouldn't think of that, being useful here, but it could be. So let's shift. I mean, we're in Washington. I mean, there's been a lot of turmoil particularly at NIH in terms of canceled grants. How has that affected their Alzheimer's work, do you think? Are you worried about that? Or is the Alzheimer's piece of their work continuing okay? Or
well, we do know, and this is a big part of our advocacy efforts over the last decade. The Alzheimer's Association, through our advocacy efforts, has been able to increase the base funding at the National Institutes on Aging from around $400 million in Alzheimer's and dementia research to where it stands today at $3.8 billion. So we know that there has been some changes. There has been some impacts on the types of grants. We and our advocates certainly want to make sure that that $3.8 billion is held steady. But not only that, we're also seeing signs that with the professional judgment budget of an increase of over around $178 million for the next round, that we are seeing some positive signs that will be included within the Senate and the House budget as well. So while we want to make sure that the $3.8 billion base is protected, we also know that this is a time to accelerate. We cannot slow down. And so continuing the increases within the Alzheimer's and dementia research budget is incredibly important. I want to just address one thing, though, as part of that, and that's what does NIA and NIH fund within Alzheimer's and dementia research? Because I think some inaccuracies have been portrayed within that. In the last decade, NIH, in the most recent reported analysis of what they fund, has only funded less than 14% of their treatment targets in amyloid. We know that NIH and NIA-related activities have a broad spectrum of what they are funding for targets for Alzheimer's, and so we are not seeing a bolus that is not impactful, because the facts are that NIH is funding a broad range of targets beyond amyloid.
So in terms, you mentioned obviously NIH funding. I'm sure that's a big priority. What are your other kind of big DC priorities? Is there action Congress needs to take more, or you'd like to see from the administration as well?
There's two big legislative priorities that we have in front of us right now, really associated with how can we ensure that all of the progress that we are seeing come out of the pipeline, all of the innovation, can reach communities and can be delivered with that promise of the intention of impacting lives. One of those is the ADAPT Act, where we're looking at providing grants to physicians for education. Some of that education could be for things like Project ECHO, where we're training our physicians on diagnosis, care, and treatment opportunities for Alzheimer's and other dementia. The other one that we have a priority on is called ASAP, and it's really looking at how can we create the mechanism for coverage through Medicare for some of this new innovation, especially around diagnostics and blood diagnostics in particular.
So also in terms of the administration, I mean, obviously RFK is now there as HHS secretary. You mentioned maybe some controversy around the amyloid pathway. How have you kind of viewed his tenure in terms of Alzheimer's? Has that been an obstacle? Have you been happy with the way he's been handling that issue, or how do you view it?
Well, right now we know that that $3.8 billion is certainly still in effect. It's still in circulation. It may not be funding the same projects that it was a few years ago. That is an incredible commitment to continue, and we want to make sure that it continues to grow over time. The piece is that we want to protect the broad spectrum of the research that is happening at NIH and NIA to look at targets, but also diagnostics and care models. right now.
Got it. So let's shift to, maybe for the daily experience of people out in the country. I mean, as we're getting these new advances, for example, for primary care doctors, I mean, do you see a shift there in terms of early detection? Are there more things that, the average person should be aware of, they should be talking to their primary care doctor with, especially as they get older?
I think one of the things that we have learned over the last few years is that individuals who have seen changes within their own cognition are increasing their ability to have that conversation with primary care. What we want to also make sure is that primary care feels confident in their ability to address anyone's concerns that they're bringing, and that they are proactively talking with their patients and their caregivers that are coming into the office about some of those cognitive concerns. We know based on our own surveys that confidence is not as high as we would like it to be. And that's why, when thinking about what can we do from a legislative standpoint, ADAPT Act is such an important piece to any of the innovation that is coming, so that we know we can support the physicians and the health systems in advancing this knowledge base so that individuals are able to receive the care that they need, especially given some of the advances coming out of the pipeline. But I think treatment and the advances that we're seeing also result in people having more confidence, more interest in learning about those things. So we are also seeing more individuals going in to have those conversations, to think about what diagnostics mean for them, and then to have the ability to make a choice about whether treatment is the right decision for them.
Yeah, that makes sense. And also in terms of, the experience of patients, I mean, there's been some discussion around, the price of some of these drugs. Have you been hearing from folks that, there are price barriers sometimes to these treatments, or has insurance coverage been, sufficient around them, or how do you view that kind of discussion?
Yeah. Right now, and certainly we have worked over time to ensure that Medicare coverage was in place for treatments as they came out of the pipeline. The other side of that, though, is the private insurance sector. And while there has been some pickup in coverage on that, we also know that there is an important area within that to work on from the private sector covering treatments and diagnostics. But you highlight an important piece, which is as we're seeing diagnostics that are available, that are more accessible, that can be used at a community level and really democratize access, we want to make sure those are covered as well. And that's the important work of the ASAP Act that will be a big priority for us to ensure that coverage of diagnostics as part of that journey, that treatment journey as well.
Yeah, so maybe let's close out with maybe some more practical side. I mean, is there something people can do, or that you do, in your life that can, benefit their brain health? I mean, are there maybe some of these are wrong, but you hear these myths about, you should do brain teasers or puzzles or something, and that will help you. I mean, what should people be doing, if anything?
Yeah. Well, I think what we learned with the U.S. Pointer study is that accountable behaviors and group settings are an important part of aging and cognition. So ensuring that the nutrition that we know works, the MIND diet, along with physical activity and social connection and engagement, cognitive engagement, along with taking care of your own heart health is truly important within that. So think about the ways you can empower yourself, ensure that your blood pressure is under control, make sure that you're getting your steps in every day. Here in DC, it's easy to do to walk between sites around the city. But the other key piece is some of the things that we're going to learn coming up at the CTAD conference around the U.S. Pointer study and things that could have benefit. And we know already exist from just a population level, but now an intervention level, sleep, and what does that play for you? I mean, I know personally there's two pieces within that I spend a lot of time with, and that's my steps, my physical activity, and also my sleep. I've become fairly rigorous about my own sleep health, but we'll learn more on that front soon.
That's good. Sleep is always good. Well, I think we're going to have to leave it there on this one, but thanks so much for joining us.
Thank you.